Hi, I'm Dr. Rhee from UC San Diego, and I am a professor of pediatrics and chief of the Division of Adolescent Medicine and Child and Community Health. Yeah, it's one of those things that I think people forget that the social environment, your exposures, are things that can also affect your health. And so we really wanted to highlight or just examine how much these social conditions were also impacting health outcomes, especially during the early days of the pandemic. Just thinking back on what was happening at that time, I think it was important for us to examine those factors as well. Yeah, I thought that was a really interesting finding in this analysis. And I think, I mean, there's a lot of conversation now around the importance of good nutrition and how that impacts your just physical functioning, your, biochemical functioning. And I think it really does impact inflammation and immune responses. And so just having a healthy diet helps you to, feel better, your body to function better, your immune system to work better. And so I thought it was really interesting that we were able to tease out some of this because I think everybody kind of just lumps all of this together. And because this data set was so large and we had so many participants, we were able to really tease out some of these nuances. Yeah, I think this is also one of these areas in medicine that hasn't gotten as much attention as we probably should. And I know there are people across the country who are looking at these things, social stress, discrimination, and really, no matter what form of the stress we're experiencing, if it manifests in our body as stress, then I think we start to trigger an immune response or greater inflammation that, again, just affects our ability to fight infections and things like that. So, whatever I think the trigger of stress is, can cause this. And if it's chronic stress and persistent stress, I think that's when we start to see the buildup of our body not being able to fight off infections because our inflammation is higher, our immune systems are not responding as well. So, yeah, again, I thought that was a really interesting finding because we don't focus on those things as much. Yeah. I mean, I think historically a lot of the research has been, what are the differences between different racial groups or ethnic groups? But I think we forget that there's a lot of social and economic differences, access to resources and things like that that are also tied to skin color and immigration status and things like that. I think this finding, the way this analysis was done, was really trying to focus on what is the social context. And it really doesn't matter what your skin color is. You could be, any skin color and experiencing these things, chronic stress, chronic discrimination. It doesn't have to be racial discrimination. It could be gender or any other, in the work environment. Any other kind of stressor, I think, has the same kind of physical impact on people over time. Yeah, I think it's something for healthcare providers to be aware of because it may affect how somebody is able to get treatment or how effective the treatment can be. Because if you're getting some treatments but still living in these social contexts that are very stressful or you don't have access to good nutrition, you're almost kind of fighting whatever the treatment is. You're not giving the treatment the best opportunity to work. So I think it is important for providers to at least understand what the social context is for the patient that they're caring for. And it may be difficult to provide resources, community resources or programs to help deal with some of those social stressors. But at least being aware of it can maybe help with the treatment journey.